Hello. Thank you again for joining us today and getting your insight on things. Can we just start with your name, your work setting, and any of your professional designations and title that you may have?
Yeah, so I'm Jaleisha, and I'm a physical therapist working in a general orthopedic outpatient private clinic in San Francisco. So in our clinic, a treatment session is usually up to an hour with 25 to 30 minutes spent with the PT and the remaining 25 to 30 minutes with an aide. So during the time with the PT, we usually perform manual and neuro interventions while the time with the aide is spent going over therapeutic exercise.
If you were seeing a patient with a rotator cuff injury, what sort of PNF techniques would you utilize for that particular patient?
Yeah, so we will see patients with a rotator cuff impingement. So I would do like a scapular posterior depression in optimal position to reduce that impingement and also improve their posture. And for post-surgical patients with a rotator cuff tear going into a repair, when gaining their range, we usually start off with passive range of motion into active assist and then active range. So I may do rhythmic initiation and replication when the patient has enough range and is cleared for active motion. Then maybe do stabilizing reversals, isometric when they're allowed to start gentle strengthening, and then a combination of isotonics and or dynamic reversals when they're allowed to progress their strength.
Do. I would like to work a little bit on getting some motion back in your shoulder here. So we're going to do something called proprioceptive neuromuscular facilitation. And really all it's going to be is I'm going to help you move your arm through a motion. It's going to look like this. You're going to keep your hand down at your hip like this, and then we're going to end up here, okay?
Okay.
So I'll help you through that. We'll start this way. Is it all right if I put my hands on you for this?
Yeah, for sure.
Awesome, okay. So we'll start this way, very good. And then I'm just gonna raise you up this way.
Uh-huh.
And that way. Perfect, and then we're gonna send you right back down. There we go. And the purpose of this is to hopefully regain a little bit of range of motion in your arm, in your shoulder, as well as then later to be able to strengthen it. How's that feeling so far?
It's feeling surprisingly good.
Feels good?
Yeah.
Alright, good.
No pain so far.
Good, that was my next question. No pain.
Yeah.
Awesome.
During the first 6 weeks of
Okay,
post-op
we'll do
recovery
one
from a
more.
rotator cuff tear, the therapist emphasizes regaining range of motion passively, using the D2 flexion pattern to facilitate
And
pattern
well done.
re-education.
How's that feeling?
Feels really good. I feel relieved.
Good, awesome.
In that time frame, the therapist can also focus on the scapular posterior depression using the PNF contract-relax technique, where the patient submaximally contracts the target muscle isometrically against the therapist for about 5 seconds, ending with a passive stretch. At about 10 to 12 weeks, the focus is to progress from passive range of motion to active assistive range in the same D2 flexion extension pattern, using rhythmic initiation. The therapist prompts the patient to bring their arm up as far as they can, and the therapist facilitates the rest of the allotted pain-free range. In each utilized PNF technique throughout the span of rehab, the therapist would verbally cue the patient to hold, push, raise, or bring down their extremity using prompts such as reach up, squeeze and pull down, push against my hand, or don't let me move you. Rotator cuff strengthening can begin when active range is at about 90 degrees of shoulder flexion and abduction. Conservatively here, we see the therapist using the contract-relax, agonist-contract method. The therapist prompts the patient to push against the therapist's palm for the shoulder internal rotation isometric contraction. In later sessions, the therapist would use this to fatigue the internal rotators to facilitate the targeted external rotators into the newly lengthened range. When using techniques involving isometric contractions, the contraction is typically held for 5 to 8 seconds to fatigue the muscle in order to facilitate a new end range.
With this particular client or patient, what would you see as being an appropriate frequency or duration for their continuum of care up until discharge?
We patient 1 to 2 times a week in the beginning of his or her rehab. So I'll usually continue to incorporate PNF in their follow-up sessions if I find that it's still beneficial in gaining their motor control, motion, strength. If it's a non-operative patient, I would maybe 6 to 8 weeks. But if it is a post-surgical patient, we usually see them for like at least 3 months, 3 to 4 months.
Well, I want to thank you again, Dr. Napolis, for your time and your insight into PNF. It's been very educational. And thank you again.
Yeah, thanks for having me.